wanted to say a big warm welcome and a big thank you for helping IAKS with the World Leisure Congress that we had recently in New Zealand. And the purpose of us catching up today is really just to give an overview for our members and particularly those that didn't go over to let them know what happened and how it happened. So I'll just pass it on to David just to talk a little bit more about the Western Sydney moving group and Nicole and how you fitted in with that and how we addressed the IAKS part of the conference. Thank you.
Thanks, Yvette. Yeah, so I must firstly say a big thank you to Nicole who went over to Dunedin on our behalf because I had a family issue there, so I couldn't get over. But great to have good colleagues within the industry. But yeah, Western Sydney moving. I suppose I'll just step back a little bit. We run a social enterprise which really aims to reduce health inequity, Yvette, within communities. That work is really focused on the ground. So we deliver a lot of programs for underserved communities, whether it be seniors, refugees, people recovering from their mental health, etc., people with disability. But we do recognise that even though we think we're doing meaningful work in the community, mostly in Western Sydney, we're kind of just adding to the problem. So health inequity is getting worse. Chronic disease is on the rise. So we need to look at how we try and tackle what is a wicked problem in physical inactivity. It's actually the fourth biggest killer in the world. So we about 19 months ago brought together a group of practitioners, researchers, academics across a lot of sectors, so disability education, non-for-profit, academia, government, to see how we could start working more collectively. And from that, we developed a community of practice where we've had 10 sessions now. We've built a network of around 170 individuals, 65 organisations, and that culminated last year with the Western Sydney Moving Symposium that we had in November. So that's kind of sets the scene a little bit. And yeah, over to Nicole on how it went at the World Leisure Forum.
Hey, thank you, David. So I guess I've been involved with David in terms of Western Sydney moving really since it started as a community participant. And I guess that's how I was lucky enough to be able to present also the information at the World Leisure Congress on David's behalf, because we were talking and David was unable to make it. I was going. I thought I'd just briefly tell you a little bit about World Leisure Congress as well. So it's actually part of the World Leisure Organization. It's been in existence, I think, for like a really long time. And I think it was actually it's been running, I can't even remember for how long, but over 50 years. And it's an international organization. And what they do is every 2 years run a biannual conference, a congress. And the congress is really about going to a different part of the country, international part of the globe, and bringing together people who have an interest in leisure and really advocating for leisure, but also on that global platform. So we often will pick a country to go to where there might be an issue that needs addressing as well. And so that we then encourage not only the practitioners and the academics in the leisure sector, but also other people who might have an interest, who are currently working on a wicked problem. And the World Leisure, so the Congress is just one of the many ways that World Leisure actually advocates with members, because we also have World Leisure Games, we have special interest groups, and just out of interest, one of the special interest groups is leisure and facilities management. So people in that space, so we'll often have lots of free webinars and networking that goes on, as well as trying to advocate and make changes at a global level. And then there's field schools where students come together again and usually do like a week in a country to understand the problems. So this one was held in Dunedin, New Zealand in 2023, where the presentation was made. But the next one will be held in Breda in the Netherlands, so back to the Northern Hemisphere again as well. So it's a great place. It was for a week. Everyone came together across the world and shared information. Topics ranged from really leisures and facility management. We looked at every aspect of leisure, so aging, access inclusion, animals, travel and tourism, children and youth, well-being, and leisure education as well is another area that they look at. So they do have quite anything that you think can happen in leisure is covered in the World Congress, gender innovation, sports, etc. So that's a brief overview. I can go on for a long time, but that's I think enough.
No, that's very exciting and very, very glad that we're able to combine. Obviously, IAKS is across 120 countries. I think there's about 9 different subsections across the globe as well. And yeah, I did a bit of research about the World Leisure, and I don't know if you can see this map, but there's a lot of different places worldwide that where the congresses have been. So really getting around the globe, which is great to see. I think the tie-in with IAKS and this leisure conference and getting you to speak about it was that a lot of our events so far in ANZ has been around aquatic leisure facilities or sports surfacing or accessibility, where this kind of ties a little bit more into how we activate public spaces and parks and how we activate communities, how we create global cities from an academic as well as a practical perspective. So I'll just hand you back to Nicole just to go through, and maybe David, you can help run through what the presentation was briefly on. I know that I think the theme for this year was learn well, live well. I don't know if that's the theme every year, but obviously learn through leisure and live well through leisure for individuals and community building as well. So I'll hand it over to you.
Actually, I'll let you talk, David, first about the presentation, if you like, and then I can add in, because, I mean, yeah, I'll let you talk about the presentation.
Well, you delivered it so well. So, but okay, briefly, it was on our work as a social enterprise. So, looking at equitable access in terms of, you mentioned facilities, but it's much broader than that. It's it's out in the community, but what we try and do is reduce health inequity. So, that is quite a broad statement, but there's a lot of different initiatives that we do. So we provided some case studies on our work and kind of showcase that. But I think the main point really that I think is important is that we feel that we can do a lot better in activating a lot of these facilities, and I know that we've got some passionate and some skilled people within the industry, but when you think about how many people use facilities, it's probably only about 20% of the population, and as I went back to before, health inequalities and inactivity is getting worse. So it's how can we work more within the system, and how can we contribute to that wider system? So how can we look at preventative health? There's many intersection points where we can improve physical activity levels, whether it's school programs, health campaigns, subsidy schemes, but place-based is a thing now. People talk about that, but how do we go about that? And there's context within each area. Each community is different, and building relationships, or designing initiatives, particularly with people from lived experience. So lived experience is expertise. And it's not just for us to come up with what we think a good physical activity program is. It needs to be culturally responsive. So we talked a little bit about that. And then, the broader project, which is Western Sydney Moving, which is that whole of systems initiative that we're kind of building slowly, trust and relationships within the system. the geographical place of Western Sydney.
And I think the one thing that as a newcomer to this organisation, IAKS, I think what David does really well, and the presentation was really clear on this, is that systems approach, but from that base level of the facilities that are available within the community. And you did say that, but I think that's the most important part. These facilities are existing, and many members would be running or within these facilities and maybe thinking, how can we do things better? And that's what David's example was, this whole systems approach across marginalised groups that really aren't normally probably a target group for many of these facilities. They're probably not the bread and butter, but they are becoming, I think they're starting to come into facilities a lot more, and facilities are sort of wondering, how do we engage with this group, or what do we do with these increasing numbers from a risk perspective? So I think that's what David does that's really important, uses that background to leverage and really activate community across different spheres that normally wouldn't coexist and interrelate. And that's what the presentation did really well. So
a systems approach. So what were the three main tips that from the presentation that really, I suppose, suggested that we do things a little bit better through the systems approach?
Trying to remember what was in the presentation now. I think it's really important to get different perspectives, Yvette. So we've all got worldviews and biases that we bring to the table, and that's through our lived experience. But getting people with different the way they see the world is important, and that's what we're trying to do. With Western Sydney Movement and our community of practices, we're bringing in people that are different, so it's not groupthink. I also feel that with systems work, you have to start somewhere and see where it goes. There's unintended consequences along the way. So you have to be able to hold the space to see what happens. Is another kind of learning for me. The co-design. I mean, that if I was focusing on, I'm going really acute there. We're talking about systems approach. It's many different things, right? You could take strategic partnerships is another key is a key thing, or school programs, as I said, or facilities. But really, I think that co-design with communities is so important for empowerment, buy-in, sustainability. Yeah.
I think, I've had a little bit of involvement with the Western Sydney Moving Group, and I think that's what really got me, and from a systems approach, is actually collaboration between all different types of user groups. Even for this conference, it was collaboration between academics and planners and people talking about how to make better systems and better processes to address the inequity and to address, the gap in the health system there.
And I think the issue is not stopping at normal lines, where we go, well, actually, that's not normally my space because I'm a leisure facility. So I only do things within my organisation. I think it's, well, let's go and talk to the experts who might know more about the elderly people who are living in this area, and how do we engage them? Instead of sort of going, well, we have all the knowledge in-house. I think that's also lends to the system approach, being open to new ideas and innovations, and not putting our head in the sand and go, well, we're doing this because it's the way we've always done it. And that's what David does well in those programs.
Yeah, I mean, just on the symposium as well, we were really pleased with the uptake of that event. So we had 104 people. There was 12 different sectors. There was some real good energy, and people were excited about it. But the one missing piece from the conference was politicians and policymakers. So that's kind of our next step to bring those in, because that's a real good enabler. Being able to tweak the system a little bit, to whether it's some subsidy schemes for our leisure facilities, during the day, that we can have underrepresented groups using them. So but from that as well, we've had some delivery pilots come out of it, really looking at an area of focus, and one of them is a social prescribing and leisure project, which Nicole has been leading and has been successful in some seed funding.
Tell me a little bit about the social subscribing, Nicole.
So in simple terms, social prescribing is really, when you go to the doctor and the doctor writes your prescription and you go and buy a medication. Well, this is the same concept, but instead of going to the pharmacy to buy a medication, the doctor is prescribing activities and connections within your local community. So the doctor might say, well, actually, you need to go and join your local gym or go to your leisure facility and swim 3 times a week, because you talked about swimming in the past, and I could see that you're really passionate when you talk about that. So let's link you in. So it's really like linking people in, and it doesn't have to sit with a GP, but the terminology is designed, social prescribing, to really link that medicalized community to the community. And so we traditionally think about the GP. It could be in many other places, but the project that David and I are successfully working on together is about GPs and really exploring, will it work with the GPs in Western Sydney? Have they heard of it? Do they want to do it? Do they think it's their place, or do they think it actually belongs with community? And it's, again, a systems approach, so bringing community with health and the medical aspects of health, because many doctors are moving to like a biopsychosocial model, but many are still stuck in that medical model, but just because they haven't had the option. So we're really exploring, hey, let's bring those GPs into this conversation now in a more formalized capacity into the community. So it was an ideal place to do it with David and Western Sydney Moving. And
Brilliant.
We have a small grant to set some foundation for some possible bigger work and bigger linkages. We've been able to set up an advisory group with the people that you would bring to the table. So across local health services, federal health funded services, as well as GPs. So it's been really good, and community, social enterprises. And that's what we want, that systems approach where people are at the table talking about what are the problems and how do we work with our knowledge, shared knowledge, because that shared knowledge, if you add it together, is years and years of experience that's going to save us so much time in the future. So it's quite an exciting project that we're working on there.
It is. It sounds like there's a few different elements, obviously. I think the thing that I love about that, though, really is with the prescription, they might go there for a physical or a mental, but then they get the social stimulation too if they do the aqua aerobics class, or if they do a boxing, or as they come together as a community. So that's kind of like an off spin for it as well. But it sounds like you're targeting GPs and politicians. So anyone out there that's got contacts, please make contact with our friends over here. Just linking it into what IAKS are doing, we do a magazine. We have a quarterly magazine, and this magazine, the last one, was actually active communities. So I understand that there needs to be policies, processes in place from a lot of different avenues, like what you suggested, David, from schools. Nicole, what you're suggesting through doctors and other health providers, but you also kind of need a little bit of idea in regards to what facilities would be planned, and I suppose even from an architectural perspective or a design perspective, that will activate these communities or that activate these centres to allow for the different cultures and the different types of health risk people, to make sure that they come in and they feel welcome and they feel like they feel comfortable to do their exercise there as well. I went to TikTok the other day, and my sister's not a very big gym goer, and she said she sent it to me because she knows I go to the gym, and she said, "This is you and this is me," like peeking her head into the gym and seeing all these people with lifting weights. and doing fantastic stuff. And she kind of walked the other way with the TikTok. So I think it's a combination effort, and I love it that you guys are getting the word out there with this. I love it that IAKS is part of it and have got you guys on board. Because this is a really important element of what we do. Our mission is to facilitate an active world. So this is right behind that. So appreciate and thank you. I think you've got something coming up, is that right? Another event through Western Sydney Moving. Have you got a symposium?
We've got the symposium again, which will be in November, which is a little bit of a way off. It hasn't been officially released yet, but will be the 21st of November on World Social Enterprise Day, and we're looking to do that at the Combank Stadium in Parramatta. So that's quite exciting. We've got a heap of actions to get through before that from the last symposium, but we continue to have our community of practice every 8 weeks, which is free. It's a virtual meeting, and we have a guest speaker there every time, so would really welcome anybody who's interested from any level or any background, who's basically a physical activity enthusiast, and doesn't have to be just Western Sydney. If they're in that area, if they're just interested, we'd welcome them as well. So that's just an invitation for anybody. Let me know.
Brilliant. Nicole,
and I was going to say, while we're sharing, can I, because we've got a great audience here that should be really excited about this. So April the 16th is World Leisure Day, and it's a day that we're hoping that it's a day that World Leisure Organisation only started during COVID as a way to promote leisure and engaging and being active in our communities, and encourage everyone running a facility to even just start to highlight the day. And if anyone wants to get in touch, feel free. I'd love to help you and resource you to promote leisure in people's lives as a way to engage and be part of their communities.
Brilliant. I love it. Well, thank you very much for your time, and thank you very much for representing IAKS ANZ at the World Leisure Congress in Dunedin last year, Nicole. I wish you both the very best and look forward to keeping in touch.
Thank you. Take it easy.
Thank you.
Thanks. Bye.